The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. I just want to welcome you to the second module of the HMIS 101 training that HUD has just started doing with HMIS System Administrators. As you all can see on the screen right now, we're going to cover three main topics today. The first being federal partners, and then a 101 view of the AHAR. And then lastly, we're going to spend some time talking about the SHP HMIS APR. So we're not going to go over the full APR. We're just going to talk about that particular APR. So a lot to cover today. My name is Natalie Matthews, and I work for Apt Associates. And today we've got Kat Freeman and Chris Pitcher from the Cloudburst Group, as well as Jeff Ward from Apt on the line to present and to take questions as we go through the webinar. Okay, the purpose of today's training and of the training series in general is really to provide HMIS system administrators and also end users or COC representatives with a fundamental or really basic understanding of a lot of the key and emerging issues that relate to HMIS implementation. So again, these topics here on the screen are what we're going to talk about today. Okay, we're going to go through everything in just about 90 minutes. Our session last week, as you know, if you were able to make it last week, went just about the full 90 minutes. So I think we'll likewise take as much time to go through everything today. It's anticipated that we're going to do trainings like this on a regular basis, and at the end of today's webinar, I'm going to show you what the next 3 webinars are that are coming up in this series, as well as some dates that we have penciled in for those as well. So we're going to do our very best to keep the format and the structure, as well as the timing of these webinars, as consistent as scheduling and HUD reporting will allow us to do. So what we're going to do today. Because there are so many folks participating in today's webinar, we do have everyone muted, so there's not a capacity for anyone to vocalize any questions that they may have as they come up during the webinar. But there is the capacity to ask a question through the sort of questions or chat function that you see on the GoToWebinar pane. So if you're in GoToWebinar right now, what you should see on your menu bar over to the side is a little questions tab that should allow you to ask a question as it comes up. And I see that there are a few questions coming in already. I do keep in mind, though, please, that since there are so many people on the phones, we're likely not going to be able to answer each and every question. We're going to, first and foremost, really try to get to those questions that relate to things like, I can't hear you or I can't see you, and just make sure that everyone can be as engaged in the webinar as possible. But if there are questions that we can get to that are more programmatic in nature or that relate to a topic that we're covering, we'll absolutely, again, do our best to cover those. But if we're not able to provide you with an answer, that is not the end of the line in terms of ways for you to get a response from us. So if after today's session you do have additional questions that either weren't answered or that you thought of after the fact, please make sure that you go to hmis.info and ask a question through the Ask the Expert function over there on the side. Okay. I do also want to make sure to note that when you do ask the question on hmis.info, it'd be really helpful if you could mention the question relates to this training. So if you could include the name of the training or just HMIS 101 training in the topic, that'll really help us make sure that we're seeing everything that comes in. Right. We are going to send out a quick follow-up survey that everyone should actually get by Monday. And this survey is really helpful in terms of helping us as presenters and as TA providers understand what's working and what's not. So please take a few moments to go ahead and complete that survey. Also, the webinar today is being recorded. We tried to record the last one and unfortunately had some technical difficulties, so I knock on wood, I think we're set for today in terms of it being recorded. But regardless of whether or not it's recorded, the PowerPoint slides will be posted on the HMIS.info website. And if you are looking for a copy of the first module that we did, I do want to let you know that it is already on the HMIS.info website. Originally, we thought it may be on the HUD-HRE site, but for now, this is where the presentation will live. So if you've not done so already, you can go to HMIS.info, and it's going to be right there on the front page under What's New, I think is the name of that title. So you can go ahead and do that. And the session today that we're going through, that will be posted on HMIS.info as well, but please be patient. It takes about 3 to 5 business days to get that up there. So we'll do our very best to get it up soon. Okay, I'm not going to walk through all these because you've likely, if you were at last week's webinar, then you've heard what the upcoming sessions will be about, and then again, we're going to go through them at the end just in terms of the next 3. But we've gone through Module 1, 2 is what we're on today, and then the remaining topics, as you can see, are going to be a bit more advanced than some of the more basic or general 101 framework that we're giving to the first presentations that we're doing. So once we get through that, those really fundamental and core concepts, we're going to move on to in-depth data standards, in-depth security, and then when it comes time to think again about things like a point-in-time count and housing inventory count, we're going to also try to do an HMIS sysadmin specific training on those topics as well. So much, much more to come. All right, so with that, I'm going to turn it over to Kat Freeman from Cloudburst, who's going to take us through our first section on federal partners. Kat?
Thanks, Natalie. Good afternoon, everyone. As Natalie said, my name is Kat Freeman, and I'm going to be providing you with an overview of HMIS participation by federal partners. So, the purpose of this session is to provide you with an overview of the status of the efforts by the federal partners in HUD to collaboratively use HMIS to record and report information on the extent and characteristics of persons at risk or experiencing homelessness. This information is being provided to COCs and HMIS implementations to assist you with HMIS planning. To be clear, because most of these programs have not published guidance or timelines around their use of HMIS participation, this update information is likely to change. Therefore, it's really important that you don't try to take it as information that is set in stone concrete. It's more about helping you plan for your 2 to 3 year process that will be inclusive of federal partner efforts. The other thing I want to mention is that if you're not actually viewing the slides, if you're just listening to this presentation, I would strongly encourage you to actually view the slides as we're going through them. We're not always reviewing everything that is on every single slide. We're sort of anticipating that you would be reading the slide as well as listening to what we have to supplement it. Okay, so HMIS and COC staff should use this information for planning purposes. I already said that. It's important that you understand that the HMIS project is not required to financially support federal partner use of the HMIS, and new programs should be prepared to financially support their own participation. However, because there will be an increase in participation, it will also require some planning to increase capacity for both the HMIS itself and its staffing. These processes will also require a review of existing policies and agreements. Now, when it comes to strategic planning, what programs provide for financial support of HMIS will likely be different in year 1 than in year 2 and ongoing. Because of the timing that these programs are being encouraged to participate in HMIS, most programs do not have HMIS as an eligible expense in their budgets at the time that the programs may approach you. That said, there also doesn't appear to be any language that prohibits programs from utilizing some of their program or administrative funds to cover the cost of HMIS participation. It is not unreasonable for the COC to require that new programs pay for their own user licensing fees even in first year, and that new programs should increase their support in following years. The COC should work with the HMIS to estimate reasonable costs going forward and then negotiate with the new programs on continued financial support to cover those increased costs. HMIS COC staff are also encouraged to accommodate new partner participation as soon as possible, but I want you to remember, it is their responsibility to come onto the HMIS in a manner consistent with their funding stream requirements. This does not translate into their participation is your emergency. You are encouraged to be thoughtful and strategic in bringing on these new programs so that the implementation is successful for both the HMIS and the new program, while being mindful of timelines being imposed upon these new providers by their funding sources. So, if you were paying attention, from a couple of slides ago, you can see that the federal partner programs that I'm going to be talking about are these 5. The VA's Supportive Services for Veteran Families program, the VA Grant and Per Diem program, the HUD-VASH program, the SAMHSA PATH program, the ACF Runaway and Homeless Youth program, and the HOPWA program. Now, the current HMIS data standards that are in effect were published on March 2010. All 5 of these programs contributed recommendations to HUD on changes to the HMIS data standards that would open the path for them to utilize the HMIS. I want to make an extra note here about the data standards. As I said, the ones that are in effect currently were published in March 2010. They will remain in effect until HUD publishes a new version. So when I speak of these programs making recommendations to the data standards, I mean that these recommendations may impact future data standards, not those currently in effect. However, it is important to note that the HMIS data standards are undergoing revision right now to accommodate the McKinney-Vento Act as amended by AHAR. Knowing that these programs have made recommendations speaks to the serious intent of these programs to utilize HMIS for data collection and reporting in the not-too-distant future. In addition, new partners, COCs, and HMIS implementations should take note that US ICH would like HMIS participation by these programs to occur sooner than later to support assessment of the federal strategic plan. Now, other than the VA programs, no timelines have been set for participating in HMIS. HHS, VA, and HOPWA will determine their own timelines for participation in accordance with their own implementation strategies. It is not yet known what implementation will look like for all of these programs, but we can provide some information to assist with planning. And there is one thing that is for sure. The universal data element mandate that already exists for all programs utilizing the HMIS will also apply to all federal partners. So it's going to be important to start gaining an understanding of how many new users might need to come onto the HMIS for each program. This can help you plan for training and help desk needs as well as licensing. So let's briefly review these programs. Great. All right, the VA has the most aggressive timeline for HMIS participation. The VA programs are all required to comply with local data collection, privacy, security, and data quality requirements. And there are 3 VA programs that are expected to either directly participate in the HMIS or contribute data to it. And that is the SSVF program, the GPD program, and the HUD-VASH program. The SSVF stands for Supportive Services for Veterans and Their Families. Now, not all communities will have this program. If your community doesn't have an SSVF program, you don't need to worry about it. And this is true about any of the programs that I'm going to discuss. If you don't have a program, past program in your COC area, then you don't need to worry about planning for it. The SSVF program will operate similarly to the HPRP program. It is focused on prevention and rapid rehousing. They are required to participate in HMIS from day one of their program activities. There is no required reporting from the HMIS. However, the HMIS must be able to export data to meet the SSVF requirements. So from a planning point of view, you will need to ensure that your HMIS has this capacity for export sooner than later. SSVF programs are required to export this data on a monthly basis. The VA will provide software vendors and HMIS staff more information on that export process in the future. You will also need to make sure that your policies and procedures are up to date to allow for data export. HMIS staff are encouraged to request technical assistance to obtain resources and guidance on which policies should be reviewed to accommodate this data export requirement. This next slide shows you the data elements for collection by the SSVF program. It is the program descriptors, all of the universals, and a number of the program specifics. Please note that there are no new data elements here. These are all elements as they currently exist in the currently effective HMIS data standards from March 2010. I would like you to note, however, that even though there's no reporting for the SSVF program, the HMIS will need to fold VA programs into their data quality processes, and that includes generating data quality reports for them. The next program is the VA Grant and Per Diem Program, or GPD. The grant component of this program is for housing development and is not expected to participate in the HMIS. The per diem component of this program is for transitional rental assistance and is expected to provide data to HMIS. Now, I want to make a special note here. Please take a look at bullets 2 and 3 on this slide. VA staff are prohibited from entering data directly into the HMIS. However, the community service provider who is administering the GPD program can and is expected to. The GPD program is only required to input the program descriptor and universal data elements, and there is no reporting required. GPD programs are expected by the VA to provide this data for community use, and the VA expects that GPD data will meet or exceed all local data quality requirements. All right, HUD-VASH. This is the third one from VA. Again, they expect the HUD-VASH program to participate in HMIS, but like the GPD program, VA staff is prohibited from entering data directly into the HMIS. That said, any community service provider can enter that data for them, or perhaps HMIS staff if you have that ability, or they can also import data to the HMIS. Like GPD, the VASH program is only required to input the program descriptor and universal data elements, and there is no reporting required. But from a planning perspective, it is important that your HMIS has the ability to import data from other sources. Next, we have the PATH program. PATH is a very flexible funding stream coming from SAMHSA. It is primarily used for street outreach activities and is targeted to identifying persons who are homeless and who have a serious mental health issue, substance abuse issue, or a co-occurring disorder. For PATH, HMIS who have already been approached by their PATH program should continue to engage in planning according to the timelines mutually agreed upon by the HMIS and the state PATH contact. HMIS implementations who have been contacted to integrate their local PATH programs are strongly encouraged to request technical assistance to assist them with this process. For all others, you should plan on a PATH implementation sometime within the next 2 years. Now, this is a very, very rough estimate because there has been no timeline established by SAMHSA for participation. You may not be contacted by your PATH contact during this time, but it does make sense to start planning for it now. Further information will likely become available as SAMHSA completes its annual report redesign and establishes more concrete guidance and timelines. It's important to note that the PATH program is a state-level program, meaning that currently the data flows from the providers to the state PATH contact. The actual process currently is that providers enter data into an online database that is managed by the PATH national TA provider. State contacts sign on to this database, review the data for accuracy, and then submit the data as final. There has been some discussion about the data flowing directly to the state PATH contacts who would unduplicate and then submit the unduplicated data to the national provider. And then there's also been some discussion that providers would submit de-identified client data directly to SAMHSA. Regardless, PATH has not developed this solution, but there is one thing that HMIS staff can be pretty much, you can pretty much know for certain, and that is that the HMIS will need to be able to export data. So again, your planning process will need to include ensuring that your HMIS has this capacity. The next program is the Runaway and Homeless Youth Programs. It consists of two different primary program types. One is the Basic Center Program, which is very, very similar to an emergency shelter program, and then the Transitional Living Program, which is for transitional living. For planning purposes, HMIS should anticipate that RISE programs will begin its process for moving its providers to HMIS sometime in the next 18 to 24 months. Again, this is a very, very rough estimate. There are no concrete decisions that have been made, and FISB will produce more information as they establish guidance and timelines. So we don't have a lot of information on what this participation will look like yet, but we do know that ACF has made recommendations to the data standards, but it's probably unlikely that they're going to actually migrate to HMIS until after the new data standards have been published. Still, an HMIS can plan based on what we already know. We know they export their data to a national database, and the number of new users can be estimated based on the prevalence of the RISE programs in the COC now. Like RISE programs, HMIS should anticipate that HOPWA will begin its process for moving its providers to HMIS sometime in the next 18 to 24 months. Again, a very rough estimate on this. Nothing has been set in stone. But HOPWA is administered by HUD's Office of HIV/AIDS Housing, and HOPWA has been interested in utilizing HMIS for some time, and they've already taken steps to more fully align their processes with those of HUD-SHP. So further information will be provided by HOPWA as they establish their guidelines and timelines. Again, we don't know exactly what this is going to look like. OHH made recommendations to the data standards, and it is also unlikely that they're going to migrate to HMIS until after the new data standards are published. But again, we can still plan based on what we already know about the program. Although it's a housing program, HOPWA funding is incredibly flexible, and a primary use of its funds are for prevention, rapid rehousing, and case management. This means that HMIS projects should plan to ensure that case management, and in particular referral tracking, is a functionality that is integrated into the HMIS. This functionality will be critical to the HOPWA programs for reporting their services provided and assessing their client outcomes. So this is just a very brief overview of how things stand now. Everything is subject to change. It could be changing right now as we're on this webinar. This doesn't mean that you can't use the information that you know about these programs to do some planning now, and you are strongly encouraged to do so. Things like, how many new users will each program likely bring on? What is their current process, and how can you use that to plan? Will you need to customize any screens to accommodate their data entry? What is the total number of potential new users that you can anticipate coming onto the system over the next couple of years? And how will that impact your server capacity needs? How does this number of potential new users impact your licensing fees? Will it go to a different level? And how will your financial support structure change, and what will the new one look like? Strategic planning for your HMIS should begin now so that you can apply for the funding necessary to support its growth over the next couple of years. This information on federal partners' efforts is provided to you only as a means to begin that planning. Look for more information from the federal partners as they make concrete decisions over the next few months. So now I'm going to hand this over to Jeff Ward, who is going to provide you with an overview of the AHAR process. Thank you.
Thanks, Kat, and good afternoon, everyone. My name is Jeff Ward. I'm an HMIS TA provider, and my comments on the AHAR section come from several years as an HMIS System Administrator, participating in the second and third AHARs, as well as being the AHAR data collector over the last 2 years. So I'm in the wonderful position of having been both a practitioner in the field and also someone working with folks in the field to try to gather this information. Chances are that your community is already participating in the AHAR. About 90% of the 453 COCs through the country were able to participate and submit usable information to the 2010 AHAR, the AHAR that was just released. If you're on the call, chances are pretty good you're either new to HMIS and you're trying to catch up on this, or you're looking for ways to expand your participation in the AHAR. Now, our learning objectives today are first to define the AHAR and explain why the AHAR, AHAR participation is important for you and your community. We'll review the sources of information used to complete the AHAR and note that a portion of the AHAR comes from HMIS and a portion of it comes from other sources. We'll outline the AHAR categories. We'll talk about data quality thresholds, try to help you answer the question is my data good enough to participate in the 2011 report to Congress? And perhaps most important of all, we'll talk about some strategies that can help you improve your 2011 data submission and also perhaps your 2012 data submission. So that is a lot of information. Let's get started. So what is the AHAR? Let's start with a little history. Congress directed HUD to provide an annual report on the extent and nature of homelessness. The report released just last Tuesday was the 6th annual report, and the first to include information about the use of permanent supportive housing and the impact of the Homelessness Prevention Rapid Rehousing Program, HPRP. For the first time, HUD was able to provide estimates on the full continuum of homelessness assistance programs, all the way from prevention to permanent supportive housing. Specifically, the AHAR provides counts of sheltered and unsheltered homeless individuals and families. It looks at service patterns of the sheltered homeless over a 1-year period. It examines national trends in homelessness. It provides an inventory of the nation's housing for homeless individuals and families. And it summarizes the impact of the HPRP program starting this year. That is basically the AHAR. It'll have a little different meaning for you, and we'll talk about that. But that's the AHAR. The AHAR is the report to Congress. And the report just released, the 2010 AHAR, if you haven't seen it yet, is available on HUD HRE's homepage. If you look on the left side on the homepage under HRE What's New, you'll have a place to click, and you can download that, review it. The first thing you need to know about the AHAR is that it is important. That's number one. It's important to Congress as they allocate funds in difficult economic times. The effectiveness of the AHAR program has given Congress confidence that the money allocated to HUD's homelessness programs is being used effectively to meet clearly defined, clearly documented needs. It informs policy at HUD as they develop programs to improve the lives of homeless Americans and to keep those at risk of becoming homelessness in housing. It's important to your community as a tool to help your COC understand the extent and nature of homelessness in your neighborhood, for measuring the effectiveness of current housing programs, as a way to measure service gaps and housing gaps, and as a source of facts to inform your community. It's an important measure of the accuracy and completeness of your HMIS data. Successful participation in the AHAR means that your data has been challenged and accepted by experienced independent data collectors. Think of it as the gold standard for data quality. It marks a significant milestone in the implementation of your HMIS. And one thing I think is key about being able to participate in AHAR is it needs to signal a change from focusing on collecting data to a focus on using data and making it valuable for all of your participating agencies. And finally, although participation in the AHAR is voluntary, HUD continues to award points in the annual COC competitive funding process for successful AHAR participation. Participation in the AHAR can affect homeless funding for your community. Now, the report to Congress is a summary of the data submitted from all COCs that participate, COCs like yours. From the local perspective, the AHAR is the process of collecting, reviewing, and submitting data from several sources. First of all, COCs submit point-in-time counts for both sheltered and unsheltered individuals and families. And they submit information on local housing inventories, whether that housing is funded by HUD or other federal agency or unfunded. Maybe it's a faith-based organization that provides housing. Even if it's unfunded, it needs to be in that inventory and is included. This submission process for the point-in-time as well as housing inventories was completed just a few weeks ago through the Homeless Data Exchange. Information about HPRP is collected through quarterly and annual performance reports, both reported through eSNAP. Responsibility for submitting this data generally falls outside of the COC, or generally falls to the COC and to the HPRP grantees. And although you're involved, you're not as involved as you are in the submission of data from the HMIS. And the HMIS is the third and most complete source, at least in my opinion, of AHAR data. AHAR sites are broadly broken into sample and contributing sites. And you probably know whether you are a sample site or a contributing site. If not, the appendices in the 2010 report to Congress provide all that information. Initial AHAR efforts focused on sample sites that could be used to estimate homelessness at a nationwide level. This approach provided quick and statistically sound estimates of the homeless populations for the first time. However, over the past 6 AHARs, the number of communities voluntarily contributing usable data to the annual report has grown remarkably. It's been quite a successful program. Contributing sites, not sample sites, but just contributing sites grew from 246 in 2009 to 324 in 2010, an increase of almost 32%. The total number of communities submitting usable data, that includes sample and contributing sites, increased from 334 in 2009 to 411 in 2010. And out of all 453 COCs in the U.S., only 79 communities submitted data that was unusable or submitted no data at all. And the key to that is if you're a community and you're not submitting data, you're really outside the norm at this point. And it's a good time to get started. There's lots of help available. Now, the HMIS portion of the AHAR is based on residential housing services provided to homeless individuals and families over a 1-year period, starting on October 1st of each year and ending on September 30th. And I promise you, you're going to get a call from someone like me, a data collector, to contact you within a few days of the September 30th ending date, letting you know that we are available and we're anxious to help you in getting your data into the system. The goal is to get as much good quality data to Congress as we possibly can. Now, the data is generally submitted by communities in 2 phases, a draft and a final. Deadlines are typically November for the draft and December for the final. And those numbers have not been finalized yet, but that's what we've had in prior years. And there are no individual extensions for submission. Now, HUD may discover for some reason that it's in HUD's best interest to delay accepting the final AHAR submissions. That's HUD's decision to make, but they do not grant individual extensions. Only the universal data elements are required for emergency shelters and transitional housing programs. Some program-specific data elements are required for permanent supported housing programs, such as the type of disability, length of most recent consecutive stay, and destination at program exit. While you may well be responsible for entering this information into the HDX system, the final authorization to submit data must come from your community COC lead, which means that when you're ready to submit that final, your final AHAR, it's been reviewed with your data collector, everything looks good, and you're ready to submit it, you're going to have the approval of your COC lead, and sometimes that takes a few days. So be sure and factor that into your thinking as you prepare to submit your final submission. These are the 6 AHAR categories. And broadly, we've got categories for emergency shelter, transitional housing, permanent supportive. And then within each one of those major areas, we break it into individuals and families. Each one of these stands alone. When we start looking at thresholds, how good does your data have to be, we look at each one of these 6 categories individually. You may be able to submit 1, you may be able to submit 6. You're not required to submit all or nothing, anything like that. And in fact, some are easier to submit than others within any given community. Now, once you submit as many of these categories as you can during the all persons section, the first part of the AHAR, once those are submitted, a second set of screens becomes available to you, and there's a subset of the AHAR, the Veteran Supplemental AHAR. So we have both an all persons piece and a vets piece. The Veterans Report follows. You can only submit veterans information if you were able to submit good quality data for the all persons, or the first section. The Veterans section, as I said, is a subset of the AHAR and remains locked out until that all persons is completed. Now, this section of the AHAR focuses only on veterans. For instance, in the first part of the AHAR, you list the number of veterans you have. Then we take just the ones that you talk about in that first part and focus a separate section on only veterans. And we look at housing inventory, not for all of the housing inventory in the community, but just that housing inventory that's dedicated for use by homeless veterans. Draft and final deadlines for veterans reporting generally follows the all persons AHAR. I'm not sure what will happen this year. The vet section was added in the 2009 AHAR, and it is reported separately from the general. So we just released the 2010 report to Congress. It'll be later this summer before the veterans portion of that is released and available. The 2009 Veterans Report is already available, of course. Okay, key to your participation is meeting certain thresholds that we look at. And your data must meet or exceed several thresholds to be considered usable for the AHAR report. First, HMIS bed coverage must be adequate. And we're going to talk about definitions here. Bed coverage compares the number of beds in your HMIS system to the total number of beds dedicated for use by homeless individuals and families in your community. Acceptable bed coverage is determined by categories. So you may well have an acceptable bed coverage in transitional housing for families and not an emergency shelter. This number is evaluated for each of those 6 categories. Let me illustrate it with an example. If we look at emergency shelter for individuals, let's say that you have 100 emergency shelter beds for homeless individuals in your community, and 70 of those beds are in a shelter that actively participates in HMIS. The other 30 beds in your inventory belong to an agency that does not participate in HMIS, and the data is not in your system. In this case, you have 70% bed coverage, more than enough for AHAR participation. Now, we will reassess that number as you work with your data collector and determine a true bed coverage. It may look like you have an agency that's participating, but when you look at their data, it is so poor or so incomplete that you really can't use it. So it can happen that you lose bed coverage as we work through the process because the data, although you thought it was good, you had assurances from the agency that they were being diligent in putting information in, it's just not usable. We also look at the housing inventory that is appropriate for the AHAR period. When you do a housing inventory for that last week of January, it is one night. When we look at AHAR, we look at a full 12 months period. So it is not uncommon to work with your data collector to modify that number or to adjust that number so it's more representative. For example, if you had a shelter that came on board in the middle of the year, we would prorate those beds and count them. They might not have even been open during the January hit. They open later in the year. We're going to adjust so that we can get a good measurement of bed coverage. Next, we as data collectors anticipate that on any given night, that between 65 and 105% of the shelter beds in a category are filled by homeless individuals. Now, this utilization measure helps us to determine if the client data entry and exit dates are correct, if they're being done properly. If we show you have a 200% bed utilization, in other words, there's 2 people in every bed that you show in your inventory, chances are that you weren't handling exits correctly. Clients didn't get exited timely, so the account was exaggerated. Same token, if you have a 10% bed utilization, you probably weren't getting clients entered into the system at all. So it's just a first start for us to measure it. Now, utilization rates below 65% or above 105% are possible, and they're acceptable if that is what is actually occurring in your community. Do expect to spend some time convincing your data collector that your utilization rates are accurate if you're outside of that range. We just use it as a screening tool. Finally, we look at data completeness. A complete data set is needed for each client if your summary AHAR information is going to be usable. High rates of missing information will prevent a category from being accepted for the AHAR. How much is too much missing data? We don't have hard numbers, to be honest with you. It just depends. And your data collector is the best source of information on acceptable rates of missing information. Now, there is kind of a hint for you. If you look in the 2010 report to Congress and you look in the appendices B as in boy 3, B as in boy 4, it does discuss missing data rates and shows you the actual experience of missing data for the 2010 report. So that might give you some insight. It may not be possible for a community to complete every category, as we said before. You might have a major housing provider that is unable or unwilling to participate in the HMIS. That's okay. You've got to deal with what you have. Now, in the 2010 AHAR report, there were 121 communities out of the 411 that reported that were able to submit all 6 usable categories. And that's pretty good. That's as good as it gets. But the average community submitted between 3 and 4. So as we'll discuss in the strategy section, it's better to focus your efforts on a few promising categories than to spread your efforts among too many categories. And I've had that with clients because they would try to do all 6. In the end, they would fail because they just didn't have the time to get everything done. If they focused on 1 or 2 or 3 categories, they could have been successful. So select your strongest categories by reviewing bed coverage first. It's going to be a waste of time for you if you try to work with a category that's indicating less than 50% bed coverage, because we can't accept that. If it looks like you have good bed coverage, then look at your bed utilization rates. If the bed utilization rates look pretty reasonable, then you check for missing data. It's kind of a 1, 2, 3 approach. Now, if you've got bed coverage, if your bed coverage is sufficient, and that is you're over 50% bed coverage, we will work with you to try to help you correct entry, exit errors, or to fill in missing data. And sometimes you can be successful with that, but it does take time. It may mean that you need to go back to an agency and you have them review their paper records and get the correct information into HMIS. Because it takes time, I got to encourage you to start real early. In a lot of ways, it's almost too late by the time we get to September 30th. But we'll talk about that a little bit. But encourage you to start early, and so you have time to work with your agencies. So strategies. What are the strategies we want to use? The first thing to focus on really is ways to increase your HMIS bed coverage, and to focus on a few good solid AHAR categories to start with, and then do what you can to increase your bed coverage. Now, if you turn around on the upcoming AHAR that will be submitted this year is 2011, if you go to work with that and discover your bed coverages are not what you'd like to be, now is the time to get started increasing those. We may not be able to submit those categories in 2011, but if you can get started, you can be collecting good information by October for the 2012. And you've got to take a long-term approach to the AHAR. This is not something that you just pencil with at the end of the month and get it done. Use your COC, a great resource. They should be able to help you to increase the number of agencies you have. Why? They have a bigger when you're in HMIS, you don't necessarily have contact with all these agencies, but folks in the COC may have relationships with agencies that are not currently participating, so take advantage of that. It can give you increased credibility. That can be your introduction into a community. A lot of times working with transitional housing is easier than working with an emergency shelter. And permanent supportive housing may be easier than transitional. Why is that? Well, for one thing, transitional and permanent supportive are funded through the COC process and have had a requirement that they participate in HMIS. Also, they tend to have less turnover than an emergency shelter, and typically they're dealing with fewer beds. Maybe you have a transitional housing facility that's got 30 or 40 beds and they're turning over clients on an average of every year and a half, something like that. There's a better chance the clients will be there if you need to collect additional information, and the numbers are just smaller. If you're working with emergency shelters, the clients are in and out, and they may have turnovers of 12 or 15 times a year. Sometimes it's easier to work on family categories than independent because they seem to have more stability within the system. But these are the kinds of strategies you need to stop and think about and focus on those areas where you can be successful, first of all, for 2011, and then be making preparations to be successful in 2012. Finally, I want you to know that that you're going to be unpleasantly surprised if you don't monitor your data quality every month from now until September 30th. And that comes from a painful personal experience. You think that your data is good, you think the agencies are participating, but when it comes time to roll up the AHAR, it's just not there. And it may mean that you thought you had 65% bed coverage, now you got 35 and you can't participate in that. So it is not too early. We're 2/3 of the way through the 2011 AHAR now, month-wise. You've got 3.5 months left. Now is a good time to run an AHAR report and see what it looks like. Now is where you have time to work with your agencies and to be successful. Definitely do not wait till September 30th. This is not a report that you wake up on the first day of October and print out a report and send it off. This is a very interactive process, very iterative. I typically, I think I mentioned, go back with my clients 2 or 3 times, 2 or 3 submissions after their draft submission. What's the 2011 AHAR going to look like? Very much like the 2010. You can expect very few changes. This is the first AHAR with the new data standards, but that really doesn't change too much. There is a registration and login process that goes with this. First of all, you need to have an account in HMIS.info. That account and username and password work with HDX, and HDX is where you actually submit your information. There is a COC primary contact listed in the HDX. They are the person that has the rights to assign those people that participate, whether it's point in time, housing inventory, AHAR. You need to go in that and check and make sure if you're planning to be putting the data into the system that you have the authority to do so. Every COC has a primary contact, and it is the COC lead. There is a sandbox. If you wanted to start working now and seeing what your data looks like, you can actually upload, for those systems that have XML upload capability, you can load into the sandbox, and you can see here an address for it. The sandbox functions very much like the HDA section, HDX, but it belongs to you. We do not have access to it. Data entered into the sandbox cannot be transferred to the official site, so keep that in mind. Don't put your final data in there and then expect us to see it. We can't see it. We can't do anything with it. So make sure when you're ready to put your real data in, put it in the HDX site. Final comment. A successful AHAR submission is a result of a partnership between you and the data collector. Submission of your draft data is really just the start. As I mentioned, you're going to go back and forth with that data collector, putting up data, reviewing data. In some cases, you're just getting assurances that the data there is correct and accurate. Be sure to use your data. The AHAR process provides an independent third-party review. It is valuable. Make sure everyone knows that your data has been included in the report to Congress. Get a little publicity out of this. And help assure that your COC is the voice of homelessness in the community. Lots of people have a vision of what homeless folks are, who they are, and what they're like by seeing someone standing on a corner. They need the facts to understand the problem that we are all dealing with and trying to resolve. Take advantage of the AHAR local report generator in HDX. If you look on the home page, the right-hand column, AHAR local report, it's a generator that produces detailed reports complete with tables and graphs using your local AHAR data, going back to 2007. So pretty amazing tool. I encourage you to give that a try. 2010 data will be up soon. Finally, be sure you monitor and report your HMIS data quality every month and help your service providers use the data that they enter. When the data is valuable to the agencies that you're asking to input all that data, they do a better job. You can expect your data quality problems to diminish to the point where there is little or no end-of-year AHAR data that can happen. And that's it. Good luck with the 2011 AHAR.
All right, thanks a lot, Jeff. To folks that were following along on screen, I apologize. I am the one here sort of holding the controls to move the slides. And as you may have seen, there were a few slides at the end of Jeff's presentation that I had to run through really quickly because I realized I was not up to speed with where he was. So I'm going to go back one slide real quickly because I believe it's an important one that Jeff spoke about, but that I wanted to make sure everyone had access to the information about. And this is the Sandbox site. So the Sandbox site that Jeff mentioned, and Jeff, if you're still unmuted, please feel free to jump in here. This is the URL here on the screen, so in case you have not yet been to that Sandbox site, you can click on this link, I believe, or jot it down and go to it at your leisure. And this Sandbox site, which, as Jeff suggested, is something that you can use to enter dummy data throughout the year and really test out, is available now. Right, Jeff? It's available at any time, I believe.
That's correct.
Okay.
It is up.
Okay. So you can go there anytime, and you can do this as a means, as Jeff said, to really test out how to use the site and to get a sense of what your data looks like. So, all right. Okay, but we got through everything else. So thanks, Jeff, and sorry for that if folks were watching and saw a couple quick flashes to get through slides. So sorry about that. All right, so we've got just over half an hour left, and in that half an hour, I am going to do my very best to get through the content that we have on the slides related to the SHP HMIS APR. I'm going to keep going until I get through. If you have to leave and I somehow don't make it through in 30 minutes, that's okay. The presentation slides will be posted on the site, and again, I believe we're recording. I tried to record, so an audio recording should be available as well. All right, so what do I mean when I say the SHP HMIS APR? And what I mean by that is that we are going to talk about the parts of the APR that just pertain to SHP HMIS grantees, or what are commonly called in HUD guidance HMIS dedicated projects. There was some confusion about whether or not a grantee should be considered an SHP HMIS grantee. There was some confusion if folks maybe had an SHP grant and spent a portion of their funding on HMIS. Was that enough to make them fill out this new APR? And the question is no. You have to be that specific grant type, SHP, and you have to be that component type, HMIS. And if you are an HMIS System Administrator, my hunch is that one of your responsibilities is probably to work with either your executive director or to work on your own to complete the Exhibit 2 and the APR that go along with that grant that funds your HMIS sysadmin activities. So we're going to go over that today. I'm going to do my best to get through all the questions that are on the this HMIS APR, but I'm going to definitely go quickly over those that are really self-evident. So I'm not going to spend time going line by line just for the sake of going through every question. I want to make sure to hit on all the key points. If after today's session you have more questions or you want some additional guidance, there is an SHP HMIS APR guidebook that is up on the HRE website right now, and that is your best and most thorough source of information about this particular APR. So please feel free to take a look at that as well after today's session. All right, so when we're talking about this APR, and if you're brand new to HMIS, you may not be familiar with the fact that the APR is a little new in some very significant ways. And what I mean by that is for several years, up until this past year, grantees did something called an annual progress report, and it was called the HUD 40118. So if you're ever in your HMIS and you see a report in there called HUD 40118 or APR, that's what that means. And now it's called the Annual Performance Report. In addition to having a new name, it more significantly means that there are new questions on there and that it's submitted electronically. So no more paper forms, no more filling out something by hand and sending it into HUD. For HMIS grantees, what's really unique about the APR now for them, as opposed to what it was like to complete an APR, the old APR as I call it, is that it's now much, much more than just a budget. I had to do an HMIS APR for several years, and it was relatively easy compared to what other grantees had to do. I really just had to fill out a budget and send it in. Now HUD wants to know much, much more about your HMIS implementation, and it's going to require you as the HMIS sysadmin, either if you're the one filling out the APR or if you are the one helping the HMIS grantee fill out the APR, you're going to need to be able to report to HUD on a lot of key things that will hopefully be readily accessible for you, either because you already pulled them out for your continuous Exhibit 1, or you just know how many users you have in a system or what your data quality is. But so long story short, it is a brand new APR in some key ways. This slide just has some of the headers, or some of the, I should say, topic areas that are covered in this HMIS APR. So this new APR asks you to discuss functionality. So what about your HMIS software do you use? Do you have the functionality to run different types of reports? Do you have different security things in place? What's your bed coverage? How much training do you do? How frequently do you do training? How do you measure data quality? And then, of course, funding and a budget is still absolutely a necessary part of this, but it goes much, much deeper in terms of asking about your HMIS implementation. Okay, I'm going to really briefly talk about eSNAP because this is the system, the electronic system that you need to utilize to submit your APR. Basic instructions on how to complete each question are going to be found at the top of your screen when you're in eSNAP. And as I've mentioned before, there is a very detailed guidebook that's on HRE right now that's the perfect reference to, well, not perfect, but it's a very detailed, very thorough reference that goes over how to complete and how to create your APR. I do want to make sure, and this is the bright text that's red here on the screen, so please make sure that you know, if you are an HMIS grantee and you've got an operating year that ends June 1 of 2011 or later, you're going to have a different guidebook to look at. And the reason for that is there are two big changes, two important changes for you to know about if you are a grantee with an operating year of June 1, 2011 or later. The first change is that the way that you create your APR in eSNAP is different. You no longer have the Step 1 and the Step 2 process that was reflected in the transition APR. The second key piece of information, or key change I should say, is that question H11, the data quality question, is no longer optional. Now that is required of everyone. So rather than providing additional detail about how to complete, how to set up your APR, how to create it in eSNAP, I'm going to highly suggest instead that you use that guidebook and that you follow the step-by-step instructions. Again, there's a guidebook on there now that is applicable for HMIS grantees whose operating years ended before June 1st of 2011. But if you've got an APR, or excuse me, an operating year that ends June 1 or later, then just hang tight because in another week or two, we're going to have a new guidebook up there that's going to have those updated pieces of information about the two changes. And those two changes, again, are a new process to create your APR, and that H11 is now required. So not huge changes in terms of volume, but significant ones. So if you can hold off for just a couple weeks, we are going to put that updated guidebook that will provide the step-by-step instructions for you on how to go ahead and do that. All right. There is a key concept that you're going to find in your HMIS APR that I just want to talk a little bit about before we go into the questions. The next 2 slides are going to talk very briefly about HMIS implementation. So some questions on the new HMIS APR ask you to report information for your entire HMIS implementation. Okay? And what HUD means by that, when it says HMIS implementation, is that you are reporting out on one of the 3 items listed here below. So your HMIS implementation can either be a single COC implementation, which means the HMIS covers only one continua of care. It can be a regional or a multiple COC implementation, which means it covers more than one COC but not the entire state. Or lastly, it can be a statewide implementation. And as a heads up for those smaller states, if you've only got one continua of care, you're considered a single COC implementation. So to be considered statewide, you've got to have 2 or more COCs, and it's got to cover all of them. The HMIS implementation, in terms of the scope of it, or which of these 3 types you're going to be, is not something that HUD determines for you. This is something that you, your continuums of care decided at the local level when they set up their implementation. And as we know, each HMIS implementation is so unique in significant ways. So these definitions are not perfect in terms of encompassing every possible scenario, but you as the grantee filling out this APR need to pick the one that you believe most accurately reflects what your HMIS implementation is. All right, and if you're not sure, you can always ask a question through the help desk. But one other thing that you may want to do is go to this particular part of HMIS.info, and it's HMIS.info/communities. And when you go there, as you can see, you're going to see a map. And on this map, I apologize, the font's really small, so you can't see it. But these things that are listed under here are all the different states. And so when you click on each state, you're going to see what HUD has on file, either by way of what you or someone that previously was the HMIS System Administrator for your area enters as the type of HMIS implementation. And you're going to be able to get some understanding of at least how someone in your community viewed it at one point. So if nothing else, if you're really unsure about what to select from those 3 options, absolutely, you can ask a question through the help desk, but also make sure that you look on HMIS.info and see what's in there. You may find information that's relevant and up to date, or you may find out that things have changed since the last time it was updated and it's a little bit different. So this is a personal call in terms of the grantee needing to decide what type of implementation they are, and it's just something that you need to be sure that you're clear about and that the continuums of care that you work with on HMIS are clear about what you're selecting as well. So again, it's not very many questions on the new APR that ask you that, but it's enough that we want to make sure we mention that from the get-go. All right, so one of the first questions on this HMIS APR is H1, and it's about, it's the lead organization, and this covers the entire HMIS implementation. So what you're going to need to do when you're filling out this is making sure that you're answering it for the entire HMIS implementation, not just the COC that's associated with this grant. Okay, so if you are, if the HMIS implementation has multiple HMIS dedicated grants, then this section should be identical across the grant. I'm going to provide a really quick example to hopefully illustrate that a little bit clearer. So let's use the state of Connecticut as an example. Let's just say that they've got 5 HMIS grants, meaning that there are 5 different COCs across that state, and each of them have an agency that is applied for and that receives SHP HMIS funds. Of those 5 grantees, let's say, and of those 5 continuas, let's say that 4 of them participate in the same HMIS, meaning they enter data all into the same software. This is just an example, again, remember. So those 4 COCs all enter into the same HMIS, and they're considered a regional HMIS implementation. And then let's say that fifth COC does not enter into that same HMIS software, and they've got their own system that they utilize. So they're considered a single COC implementation. So when the APR is being completed, the 4 continuums that all have the same, that are all part of the same HMIS implementation, the information that they enter for this first question should all be the same. So they should all have one lead organization because they are part of one HMIS implementation that they list here. So make sure that if you're part of multiple COC implementation, you guys are talking to each other and you're clear about what information is going in there and who, what the various roles are. Hopefully, the completion of this APR is not the first time that these types of conversations are happening, but especially if you're new to HMIS, and especially because this is a new type of APR, it's something that you as a sysadmin want to make sure you're clear about. So make sure you know who the lead organization is for your HMIS. All right, I'm going to go really quickly through this. This is just the contact person. So again, HMIS implementation is the area that it's covering. All right, and then this portion of question 1 is asking you to not only select your implementation type right here, all right, but also to choose which COCs are a part of your HMIS implementation. So if you've got more than one, you're going to select it and hit it over here by using that arrow. And then you've got, again, several other parts to this question that are going to pertain to your entire HMIS implementation. Okay? Much more detailed instructions about each part of these questions is provided in that guidebook. So many of them are fairly straightforward, but if you run into anything that you're not familiar with, like this last part here where it asks if you get unduplicated counts out of a data warehouse and you have no idea what a data warehouse is, or if you've got one for that matter, please go to that guidebook first, and then again, you can always ask the question through the virtual help desk as well. Okay. This next question is the HMIS implementation and staffing. And this, it's important for you to be looking at the screen right now to see that for this question, it's a little bit different because it's asking you to provide the same information, so 2A all the way down through 2G, for both the COC that's associated with this grant and the entire HMIS implementation. Before I go any farther, I just want to clarify what I mean by the phrase COC associated with this grant. So what that means is that when you, as the grantee, applied for funding, and you applied for funding using an Exhibit 2, you had to submit that Exhibit 2 under the Exhibit 1 of a particular COC. So let's say that you, as an example, applied for your funding under the balance of state COC. Then you would provide answers related to this column for just your balance of state continuous care. Let's say that you've got, in that first example that we used, there were 4 COCs, right, that were a regional or a multiple COC implementation. So you've got 3 more COCs in addition to that balance of state that you've already given information for. You've got 3 more that are part of your implementation. So this next column is where you're going to provide information for all 4, the entire implementation. So it seems a little odd to break out the information like that by the COC associated with the grant and the entire implementation. But the purpose of this is to provide HUD with an understanding of really how the HMIS funds are being utilized and how big of a piece of the pie, so to speak, this one continuum of care that's associated with your grant takes up of the entire HMIS implementation. So it's a new way of looking at the data, and it's a new way probably of you even thinking about your HMIS implementation in the COC. But if you've got a good HMIS, then it's hopefully some information that can pretty easily be provided for you. So Again, though, if you're having trouble getting access to any of this information, like 2F is one that I'm looking at, the number of active users that have logged into the system in the last 30 days, hopefully your software has either something on the back end that you can look at in some sort of administrative or reporting capacity. But if not, talk to your vendor and see if this is something that they can help you with if you're really struggling with it and you have no idea how many users active or not that you've got in the system. So do the best that you can to provide this information, and again, please make sure that you're going to that guidebook for more detailed instructions as needed. All right, this next question is asking you to talk about participation by program type. Okay, so again, this is a question that's going to be asking you for information in a couple different ways. So these two columns that we see on the screen here right now for this question are the total number of COC programs and then the total number of COC programs that are participating in HMIS. It's important that you only talk about the programs and the COC that are associated with your grant, so this is not a question that applies to the whole HMIS implementation. It's just the COC associated with your grant. Okay? If there are multiple distinct services that are offered, so let's say emergency shelter and follow-up rental systems are offered, then each component is going to be treated as a separate program here on the screen. Okay, so this is something that these program types that are listed here are from the HMIS data standards, and they are something that should be set up in your HMIS in terms of you having the capacity to look at programs by program type. This should hopefully not be new. It's important for you to note that victim service providers, so often called domestic violence providers, should not be counted in the total number of programs in the COC or in the total number of programs participating in the HMIS. And the reason for that is because, as we all know, victim service providers should not be participating in HMIS. They should not be entering data into HMIS. And so it's not appropriate to include them in either column. If you've got a community that has a lot of domestic violence providers, let's say, and we know because they're prohibited from entering data into HMIS that they are not going to show up in this column in terms of participating in HMIS. We don't want it to sort of count against or look bad for that continua. So victim service providers, an important part of the continua and providing really necessary services, but for the purposes of this HMIS APR and for this question in particular, they are not a part of your universe right here. Okay. The next question is the functionality question, H4, and this is a question that's got, again, several different parts to it. It's got 4A all the way down through 4F, so it's going to ask you about several different functionalities. And what the APR is asking you is to indicate whether or not your HMIS supports these functionalities. To base your, please, when you're doing this, make sure to base your responses on the software functionality as it has been configured and as it is in use within the COC. Okay, and we'll show a couple examples in just a minute so you can understand the differences. It's considered that the HMIS supports the functionality if that functionality is available by the end of the operating year, and it's considered not supporting that function if it's an add-on that's offered by the vendor but not something that's purchased. So let's just use as an example, let's say that the software that you're using has a really neat referral functionality where you can refer clients to 211. But this is not something that comes standard with the software. It's an additional packet or it's an add-on that you have to buy, and you have chosen not to buy it as part of your HMIS implementation. You can't count it then as something that you support. So this section, again, pretty straightforward in terms of what you need to check off here. All right, so this first example is, again, you're going to see for each part of it, asking you, does your HMIS support it, and do you use it? So it's one thing to have service tracking, and as we know, it's a whole other thing to use it. So as you're going through this, make sure that you again, are looking at the guidebook for definitions about each of those different functionalities, but many of them, like client intake, case management, reporting, these are all parts of your HMIS that are hopefully readily available and that are things that you can easily check off. All right, and the last part of this question asks you to talk about any plans that you have to enhance your HMIS software. So let's say that you've gone through the functionalities listed there in 4A through 4E, and a bunch of them are things that you really wish that you could do with your HMIS and that you have every intention of adding on, but that are not there right now. This is a place, 4F, where you can write in and tell HUD that you are planning on adding these things, but be sure to only say that you're planning to enhance them if you're really planning to enhance it, not if it's something you're going to do if you get a $50,000 grant or if you get something. So make sure you add it in there if it's something that you think is a credible enhancement, meaning it's something that you can realistically see happening sometime soon. Okay. All right. The next question is electronic data sharing. And this is the question that asks you to talk about what, if any, data sharing is going on in your continuum of care. So this is another question that only pertains to the COC associated with this grant. Okay, so you're not reporting on your whole HMIS implementation. You are only reporting on this continuum of care that's associated with your grant. So even when data sharing is authorized among providers, it may be something that's governed by client consent procedures. This question, however, only relates to the data sharing that may occur within the HMIS itself and does not include data sharing among case managers during the case management process that's outside of HMIS. So although you have two providers that may be more than willing to share paper documents and may be willing to case conference or talk to one another, this is only talking about data sharing that's happening electronically in your HMIS. Okay? So the choices that you're going to see on screen are as follows. You're going to see all, meaning that all client records are shared. This is often called an open system. And what's meant by that, is that all client records can be accessed by all participating homeless programs within the COC. Greater than 50% simply means that more than 50% of the client records are shared among the participating homeless programs. Less than 50% means that fewer than 50% are sharing. Also case-by-case basis is an option that you'll see. And what this means is that the sharing of client records only occurs on a case-by-case basis when the client authorizes the agency to share data with another specified agency for the purpose of a referral. Or you'll see not permitted, which, as we all know, happens. And this means that client data is never shared electronically. Hopefully this is not the case in your HMIS, because that would make several other parts of your system pretty tough to manage, but it happens. So HUD has that down here as well as an option. If you do select not permitted, then you're going to have to describe, I'm sorry, let me run back real quickly. So if you select anything but not permitted, then you're going to be asked to then, in the question below, or the portion of the question below, describe what type of client information is shared. Okay, and you're going to see options like all, meaning everything's open and everything is shared in that client record. You're going to see limited as an option, so maybe your continuous has said, you know what, we only want to share the last four of the social and the first and last name so that we can search for the client, but we can't see the case notes or we can't see the detailed assessment history. So you're going to have a few options there as well, and it's, again, asking you to identify in this APR what the data sharing is electronically and what it is electronically in your continuum of care that's associated with this grant, so not the whole HMIS implementation. Okay, the next question is training. All right, and this is going to ask you to identify how frequently several different types of trainings are offered. We're going to see that here on the next slide. All right, so this example right here is of one of the trainings that it's going to ask you about. So Do you provide training on standard operating procedures? If so, is it required? Is it optional? If you do offer it, how frequently do you offer it? How many people have completed it in the last year? So this is type, requirement, frequency, and completion are the 4 parts of each training question on here in question 6 that you're going to be asked to respond to. So use your judgment. Keep good records of what you're providing as training. It doesn't need to be in-depth in terms of, HUD's not looking to create a new bookkeeping capacity for you as an HMIS sysadmin, but hopefully if you're doing a training, you've got sign-in sheets that are done electronically, or you've got registration if it's happening online. So, as you think about ways to improve your capacity to get this information gathered so you're not waiting until 10 days before your APR is due, think about this as being something that you can start tracking either in a spreadsheet or some way that's accessible for you quickly when it comes time to do that APR so that you know what you're talking about. Okay, H7 is follow-up requirements, and it's just going to ask you to state whether or not you've got any follow-up requirements for the trainings that you just identified in the other questions. And if you do have follow-up requirements, HUD's asking you to just talk about them briefly and go over what these requirements are. Okay, data timeliness is asking you, again, to identify if there are any policies in place for requiring agencies entering data into HMIS to do so by a certain time or to do it after client intake or anything like that. And when we say CHO, or CHO, which is on here right now on the screen, we mean Contributory HMIS Organization. And the definition for that is provided in the data standards, but I'll briefly read it. A CHO is an organization that operates a contributory homeless assistance or homelessness prevention program or a contributory non-homeless assistance program. What we mean by that is that you've got programs, these are the programs that are entering data into your HMIS. Okay, just a few more questions left. There are only 13, I believe. I'm testing my memory. I believe there are 13 questions on this HMIS APR, and then 14, a narrative, optional narrative question at the end. So H9 is asking you to talk about data quality, and again, in a narrative form after you've stated yes or no, to talk about what you have for data quality procedures. These types of questions are things that may be familiar to either the Exhibit 2 process when you applied for the funding. These may be things that you already talked about to HUD in that way, or maybe part of another planning process that you have throughout the year. So hopefully not the first time that you're thinking about or writing about data quality, and a brief narrative is what you need here to really describe for HUD what you do for data quality. Okay, the H10 questions, and again, this is another question where there are several different parts to it. This question and all the parts are listed here on the screen. You are telling HUD what the bed and unit participation rates in HMIS are, for all of these various program types that are listed here, and you're doing it on different point-in-time dates. So similar to what you do for the sort of regular APR in terms of bed and unit participation. And this is another question where you are responding only on the COC that's associated with your grant. So you don't need to do this for the whole implementation. You just need to have this data available for the COC, the programs that are in the COC associated with this grant. All right, so the 3 program types that you're going to report out on are the usual suspects of emergency shelters, transitional housing, and permanent supportive housing, and then 2 different point-in-time dates. The last Wednesday in January for each of those program types, and the last Wednesday in July as well. All right, this screen just shows you what each of those questions look like in eSnap. So year-round unit information is only collected for permanent housing. That's a note here on the screen that we just want to make sure you're aware of. And when you're responding to 10A through 10F, You're going to report out on unit participation by these two different household types, I believe, without children and with children. I think, however, that the screen may just be cut off a little bit in terms of the snapshot that I got. So I think you're actually going to be reporting out on these, and I apologize that it doesn't look like that here on the screen. But again, the guidebook will have additional details about this, but it is point-in-time counts for bed and unit participation for 3 different program types at 2 different point-in-time dates, and it's asking you to report out on the number of beds, the year-round beds that are in HMIS, the year-round units, number of people, bed coverage, bed unit, and unit utilization. These last cells down here that are all the percentages, meaning they're the bed coverage and the bed and unit utilization rates, these are all things that are calculated by eSNAP. So you're going to enter the information up here. An example is provided about how many beds you have and then how many beds are in HMIS, and then that's going to give you a coverage rate down here. Likewise, you're going to have a number of people that were in residential programs, and then you're going to have a number of households, and that is going to give you, you've got the beds, listed up here. This is going to give you a bed utilization rate. So the first percentage is taking the year-round beds and the year-round that are in your continua, and then it's taking the year-round beds that are in your HMIS, and it's telling you what your bed coverage rate is. And then the second percentage is taking those year-round beds in HMIS, and it's taking the number of persons that are in HMIS, and it's giving you a utilization number of 100%. So some of these things are items that will, again, be calculated by eSNAP, and it's based on what you put in there in the system. Okay, we're getting close to 4:30, but as I mentioned, I'm just going to keep going to make sure we get through the material. We've got a bit more left, so if you do have to get off, I understand if you need to leave the call. But if you can hang tight, then please feel free to and listen into the rest of these questions. Again, just a few more questions that we're going to go through. So so once you get to the end of 10A through 10F, and you've given all that information about those 3 different program types at those 2 different point-in-time count dates, you're going to be able to show, to explain to HUD why you didn't have 100% bed coverage in some of those bed types. All right? So you can talk about any barriers that you may have included or that you may have encountered, and then any plans that you may have for improving that bed coverage. An example of this would be if you have a faith-based provider that will not enter data into HMIS, but they make up half of your emergency shelter beds in your community. If your coverage rate is only 50%, then you're going to want to tell HUD that's why it's only 50%, and you're going to want to describe what some of those barriers were. Keep in mind that you're going to have to do all of that explaining in 2,000 characters or less, and that goes by pretty quickly. So hopefully you've got good bed coverage, and it's something that you can succinctly explain to HUD in terms of why it's lower. Okay, H11 is the question that I mentioned at the beginning of this presentation. It's the data quality question, and I mentioned it at the start because this was optional for grantees whose operating years ended before June 1 of 2011. Now, for any grantee, or HMIS grantee, I should say, who's got an operating year ending on June 1 or later, you have to complete this question. So eSNAP will not let you skip this question any longer. This data quality question should look pretty familiar to information that you submit to HUD for the Exhibit 2. And it's important for you to look at this data quality really throughout the year. Jeff mentioned this when he was discussing AHAR in terms of making sure that you're looking at your data with frequency so that there are not surprises when it comes time to run that report. And the same rings true for data quality. So as a sysadmin, know your data quality throughout the year, look at it with frequency, and make sure in advance that your HMIS software can generate the reports that you need to tell you what your data quality rates are for these different data elements. Okay? All of the questions and a questions template are on HUD-HRE.info, and so make sure that you're looking at these in the guidebook and on that website well in advance. Okay, your data quality, is reported out not only by the different types of data elements, so the universals or the program descriptors or the program-specific data elements, but they're also reported out based on program type. So you're going to report on data quality for your residential programs, and then you're going to report on data quality for your outreach, your support services only programs as well. Okay, age 12, we are getting into stuff that should be familiar in terms of familiar to either something you've submitted in your Exhibit 2 and what was normally done for an APR, and this is the funding or the budget section. So you're going to report in age 12 on funding sources that were spent during the operating year. You're going to include any money that was received as cash match, and you want to be sure that you are basing this on what was committed in your Exhibit 2. So you had to, when you submitted your Exhibit 2, come up with some match, some match requirements as well, and make sure that you're looking at your Exhibit 2 and that you are reporting out on what, based on what you put in that Exhibit 2 as well. All right, H13 is still budget, and this is asking you to report out on expenditures. So H12 was asking you to talk about what money you had coming in throughout the year, and H13 is asking you to tell HUD what went out during the year. So you're going to report out on expenditures by these distinct expenditure types that are listed here. There is a capacity to put an other down here at the bottom. And then we are going to have this information all totaled for us by eSNAP. So anytime you see a grayed out cell like that, it means one of two things. It means either that part of the question is not applicable to you, and so you don't need to answer it, or it means that eSNAP is auto-calculating that for you, so you can't enter data. So that's another eSNAP thing to mention. All right, and lastly, we have got H14, which is your narrative section. Again, it's optional. It's a maximum of 2,000 characters, and it is your chance, if you feel as though you have more to say to HUD about this grant or about your HMIS implementation, here's your chance to do so. So it's another shot to put in more information to further define and to further describe what all of this APR information meant for your grant and for your COC. Once you get through everything, you're going to see at the end an eSNAP screen that says Submission Summary. It's going to have all the questions listed here on the left-hand side of the screen, and then it's going to say Last Updated here. So if you see anything that says Please Complete, that means that you did not fill it out and save it properly. So you need to go back to those portions and make sure that you fill it all out. You want to make sure that everything in this column says either the date that it was last updated, and please make sure that it is the last updated date that you want it to be. And what I mean by this is, as we all know, eSNAP is sometimes not the speediest system in the world. So it is absolutely possible that you may start your HMIS APR on, let's just say, the 10th of June, save your information, and then come back to it on the 13th. Everything is time-stamped, and so let's say that you want to make sure before you submit your APR that everything has been checked and you have gone back in and you've saved and updated all the information. So look at every screen and make sure that the information that's time-stamped there is accurate and that is what you want it to be. Okay? Once you are done and once everything is has either stated last date updated as a date that you want, or it says no input required, which is you'll only see that for H14 because it's the only optional question, then you can go ahead and you can hit submit. There's another little button right here that's mentioned on the side called export to PDF. Highly, highly recommend that you do that as well. And what this is going to allow you to do is to keep a copy of what you submitted to HUD for your own records, and you can either save that, or if you really like having the paper around, you can print out that PDF, but make sure that you've got your bases covered and that you've got copies of what you need by when you need it. All right, these last couple slides that we're going to go through, or that I'm going to go through quickly, are some tips. All right, and again, these materials are going to be on HMIS.info in case you want to use them as a reference point for things to think about as you're getting ready for your new HMIS APR. So one thing that I think is really important to know is to know that you can generate the following reports. You want to make sure you can run reports that identify how many programs participating and non-participating you've got, how many programs participate through data integration, and that's not going to be a report, likely, the data integration piece. That's going to be something that you as a sysadmin just need to know. You want to know how many unduplicated active homeless clients you've got in your HMIS. That most certainly will be a report. And you want to know how many users and how many active users you have in the system as well. So make sure that you can get to the information that you need, either through a report or through discussions with your continua or through just the administrative data in your HMIS. Make sure you know what you need to know for this APR. Also make sure that the new programmatic data standard fields, and what that means are the program descriptor data elements. Make sure that all of those are populated for all of your homeless programs within your HMIS coverage area. If they're not, it's going to make answering some of these questions pretty hard for you. Also make sure that you've got the functionality components available, that you've identified which ones are available and which ones are in use within your system. Also, think about any of the functionalities that HUD has listed in this APR as things that they want to see if your HMIS can do. If you can't do them right now, think about why you may want to and why HUD may be suggesting that they be functionalities. And think about if there are any ways for you to enhance your system or to work with your vendor to make those things happen. So these are not functionality requirements per se, but make sure that that if they are requirements, meaning if there's something in there that is a part of a technical standards, make sure that you know and you understand how and if your HMIS can do that. And this may be best done if you're not familiar with the software, or if you're not familiar with every part of the software. This may be a good thing to have a conversation with your vendor about as well. Okay, it's also recommended that you track your trainings on a regular basis, and like I mentioned, track who's coming and know what you do for follow-up. Also look at your point-in-time counts with regularity so that when it comes time for you to run this data for your APR, you've got what you need and that it looks correct to you. Don't wait until that APR is due. Also make sure that you're looking at your housing inventory counts on a regular basis as well, so that you make sure that everything's up to date, and look at your bed and unit utilization information regularly. Often you're going to want to check these points of data with the actual programs that are entering it, because what may look all right to you as a sysadmin may not look okay to someone at the program level that's actually implementing the data. So, or not implementing, I should say, but actually working with the clients and actually knows their bed capacity. So make sure that you not only as a sysadmin look at the data with regularity, but that you talk to your continuum of care and talk to your providers in the continuum about what the data says. Make sure that it's clear ahead of time. And again, as I've mentioned, most of the questions on this HMIS APR relate specifically to the COC that's associated with your grant. So if nothing else, make sure that you know, first and foremost, which COC that is, and then that you know you can get this data for that specific COC. Okay, I think this is our last tip slide. It's a lot of tips, and I apologize, but it's a lot of information that's new if you're doing this APR. So also make sure that on a regular, suggested here, a monthly basis, that you're looking at data quality and that you understand how you're implementing data quality checks in the continua and implementation. Meet regularly to understand what your expenditures and what your income are for this grant. And then think about what you might want to include in that narrative. Again, that narrative is optional, so I don't want to put too much emphasis or too much priority to that. It's really most important that you think through the other 14 questions that are on that APR. 14 sounds manageable, so it's different in terms of it not just being a budget, and it's much more in terms of it being 14 questions. But compared to what the grantees who are implementing housing programs have to do for APRs, it's not too bad. So just make sure that you devote some time to yourself as well to make sure that you've got what you need to submit your APR accurately. Okay, and the APR is something that is regularly updated, meaning there are lots of HUD resources on HRE, and there is a virtual help desk as well that is staffed. So this is a screenshot of where to go to get HRE or to get APR information on HRE. So ahead of time, take a look at that HMIS guidebook. We've done the webinar today, and we'll post this information on hmis.info. And if you have questions that go above and beyond what we've talked about today at any point related to the APR, absolutely submit a question through that help desk. That is your best way to get official HUD guidance on something, and it's the best way for you to make sure that you know what you need to before you go in and submit that APR. All right, really quickly, I'm actually just going to leave this on the screen, and that we're going to end with this. I want to make sure that folks know what's coming up next. So these are the 3 modules that are scheduled next. The next one is not until August. We're going to have, or the next 2, I should say, are in August, and they're going to cover, the first one's going to cover an in-depth review of the HMIS and data technical standards. So this is not going to be another 101 in the same way that the first 101 on data standards was. And what I mean by that is that we're going to spend the full 90 minutes on those data and technical standards. So lots of opportunities to get into the elements, to talk about some quirks with each of them, to give specific guidance on how best to implement 90 whole minutes on those data and technical standards. After that is going to be security, privacy, and governance. Again, the full 90 minutes just on those topics. And then lastly, in September, we're going to spend another full 90 minutes talking about data quality standards and compliance plans. So key and timely topics that we hope to cover with everyone, and a couple months off before we have go through this again. So thanks again for hanging in there. I realize we did go a little bit over, but I wanted to make sure we got through all of our content. If you've got any questions as a follow-up, use those help desks, and we will post these materials very soon to the HMIS.info website. So thanks a lot for hanging in there, and enjoy your weekend.
Is everybody still on?
Yep. I just saw the note. There was a question that came in.
There was one, which I don't know how Chris handled it. I don't know if he. Chris,
okay.